Hello and welcome. My name is Rosa and I'm from AinsCorp, and we distribute salts ostomy products throughout Australia and New Zealand. Today I'm going to discuss troubleshooting and help identify any possible problems that you might have with your stoma and try and help find some suitable solutions. And if we can't find those solutions, refer you on to the best places to help. So there are 4 key steps in our troubleshooting guide. Number 1, we need to identify what the problem is. And then number 2, we need to explore the reason or reasons why that problem might be occurring. And this is a really important step because we may have identified the problem, but if we only try and fix that problem and don't fix the reason that problem is happening, it may reoccur. Number 3, once we've identified and explored the problem, we need to find a solution. And you may be able to do this by yourself, or you may need some extra help from an external person as well. Then number 4, we need to choose a product, and that may be the product that you were originally using, or it might be a new one or an additional one. So I'm going to take you through how we might think about troubleshooting some of the more common problems that we see around stomas. And the first big one is sore skin, and this is a really common problem that we see. So a lot of people think that, oh, well, if I've got a stoma, then the skin around that stoma, it's normal for it to be a bit red or a bit sore. And that's absolutely not the case. The skin around your stoma should feel and look like the rest of your skin on your body. Just because we have a stoma there, it shouldn't be red, inflamed, itchy, or sore. And if it is, we need to troubleshoot that area and try and come to a solution to fix that problem to make life a little bit easier for you. The first thing it could be a sensitivity to the product that you're using around your stoma. So we can look at things like, does the sore area exactly mirror the base plate that you're using, and that's the sticky bit that sticks your pouch onto your skin. If there's a red area that's exactly the same shape as your base plate, it might be that you have a sensitivity to the components in that base plate. Or does maybe the skin doesn't look red, but it feels quite itchy. Again, you might have a sensitivity to that product. And these are best talked about with a stomal therapist if that's the case. So if you notice any of these things, chat to your stomal therapist and they might try you on a different product that may not cause a sensitivity. Another question we need to think about is, have you recently changed to a different appliance or product? Have you used any new products on your skin? If so, this change might have caused a little bit of sensitivity, and again, might be good to talk to your stomal therapist about, or go back to your other products and see if the problem is solved. Do we have a change in our stoma output? So this is potentially quite an easy fix. So we just need to think about, have we eaten or drank anything different recently that could be the cause? Have we recently travelled abroad and the food might be a bit different, or drunk some water that might not be okay? Are you having any medical treatment or taking any medication that might be affecting your bowels and your output? And for urostomates, could you potentially have a UTI? So a couple of things we can look at ourselves and potentially try and fix. So thinking if we've eaten or drunk anything that might have upset our stomach, maybe just go to plainer foods and back to your normal diet for a bit and see if that solves the problem. But things like medical treatment and taking medication or potentially having a UTI, these need to be talked about with your GP, a specialist, or your stomal therapist. The next one is, do we have some trauma to your stoma or your skin? So if you're cutting your stoma product out to the size of your stoma, are we cutting the hole to potentially the wrong size? So making sure that we measure the area around our stoma at least once a week to make sure that we are still cutting to the right size is really important. We don't want to have any skin visible around that stoma to make sure that we don't get any output going onto that skin and causing some trauma. Are we potentially changing our products too frequently? So every time we change our product, obviously, your skin is having something taken off the same place all the time. We need to be quite careful with the skin. So maybe we're taking it off too frequently. So try leaving it on just a little bit longer and seeing if that makes a difference. Or on the other hand, are we potentially leaving our products on for too long? Some skin likes to be changed more frequently. So if you maybe change your product every 3 days and that's making your skin a little bit sore, maybe try every second day. And another one that often comes up is the surrounding skin of your stoma quite hairy? Because like I said, we're pulling something off the skin quite a few times every week or even every day. Are we potentially pulling those hairs and creating a bit of trauma when we pull those hairs every day? So this could be solved by potentially shaving and keeping those hairs quite short. And then the last one is our appliance or product or pouch fitting correctly? So think about things like, have we gained or lost weight recently? Because this can affect how your bag sticks. Have you developed a hernia? Because again, we might need a different product to cope with that hernia. And has your stoma changed shape? Does it protrude more, or is it more flat to the skin, or has it even retracted below the skin? And these things, especially your stoma shape and a hernia, and even potentially gaining and losing weight, these are things that are good to talk about with your stomal therapist, and they may adjust the products that you're using. So the second problem we're going to talk about is leakage. And leakage is a big concern for most people with a stoma. It's not something that we want to happen. And if it does happen, it can often cause some issues like sore skin that we just talked about. So, for example, if we do have sore skin, have we developed a sensitivity to the appliance or products that you were using, like I just spoke about? Have we got an alteration in the output from our stoma? Like, is there more? Is there less? Is it a looser output than normal? And is our pouch potentially not fitting the right way? So thinking about all these things, and we might be able to fix one of those to solve the problem of leakage. Do we have some creases or uneven skin around our stoma? When we apply your appliance, does the base plate, the sticky part, sit unevenly, or does it stick quite well? When you sit down or bend, does your appliance feel like it's pulling away from your skin? And when you remove your appliance, is there a track of feces or urine on the actual sticky part of your base plate? Because there shouldn't be. We don't really want it to be on the base plate because then it's also right next to your skin. So thinking about all of these and how your pouch fits on your body and around your stoma is really important. And if you have any concerns about this, it's best to talk to your stomal therapist, and they might try a different appliance or maybe some accessories like a belt or a seal to help your appliance fit a little bit better on your skin. And like I also just mentioned briefly with the sore skin, but it also applies to leakage because sometimes stomas can change shape. And if your stoma visibly moves about and changes shape, that can make it really hard to get a good seal and to not get a leak. So if it telescopes in and out and sometimes retracts to below skin level, like I've talked about, it's harder to get a leak with these cases. So it's best to advise your stomal therapist of any changes in the shape of your stoma, and they can advise you best on how to fix them. So you'll notice that quite a few of the problems that I'm talking about often relate to each other. So I'm going to talk about adhesion now, which is how well your pouch or appliance sticks to the skin around your stoma, but that's also affected by leakage and potentially sore skin as well. And likewise, sore skin can be affected by how well your base plate sticks to the skin around your stoma. So they're all important and they all impact each other. So if we're having some issues with how well our pouch sticks to our skin, we need to think about things like changes in our body shape. So has our abdominal shape changed? Have we gained and lost any weight? Are there potentially some creases or uneven skin around our stoma? And again, when we sit down or bend and move, does the appliance feel like it's pulling away from your skin? And like as well, we were just talking about with leakage, when you take off the appliance, is there that track of feces or urine? Has it gotten under your base plate and gone along your skin, potentially affecting that adhesion of the base plate? Another thing we need to think about with how well the base plate is sticking to your skin is a change in output. So has the consistency changed? Have you changed your diet recently? Maybe you've gone traveling and again, it's not food or water that you're used to. And are you going any form of treatment or taking any medications that might affect the output of your stoma? How often are we changing our pouch? So, like I said, is there anything that's preventing good adhesion, like hair, or you're maybe using some barrier creams, or you've got some sore skin and that's affecting how the pouch sticks to you? Are we removing our appliance too frequently? Or again, are we leaving it in place for too long? So have a think about all of these things and see if there's anything that might have changed in your routine. And again, it's best if you relay this advice to a stomal therapist and give them all the information that you've collected, and they can advise you on the best way to go ahead. The next stoma problem that we're going to discuss is odour. And odour can be related to quite a few different things. And the first one is potentially poor adhesion or stickiness of your product to your skin. So we need to think about, does your base plate have a complete seal, or are there maybe areas where it's not completely stuck down to your skin all the way around your stoma? Does your base plate have a tendency to push away from your skin throughout the day? And is this potentially even related to the clothing that we're wearing that might be affecting how well that base plate sticks to our skin? And do we potentially have a hernia that might be altering how well that base plate sticks to our skin? So some of these things are things we might be able to solve ourselves, and if we can't, then it's best to talk to our stomal therapist. So things like changing your clothing to see if that has an effect on the stickiness of your base plate and reduction of odour, that's something that you can try yourself. But if you've got a hernia and you think that might be affecting how well your products stick, something like that is best to talk to your stomal therapist about. This one I keep saying, but prolonged wear time. Have we been wearing your pouch longer than necessary? Your stomal therapist will advise you how often to change your pouch, and it's pretty good advice. They know what they're talking about. So try not to go too long in between pouch changes because it affects how well the base plate sticks, and therefore it might have an impact on the odour that's getting out from that pouch. We need to think about hygiene. So is your skin completely clean and dry before we put on a new product? If your skin might be completely clean, but we might not have dried it enough. And then when you're putting a new pouch on, it might not stick to that wet skin very well. So that might be affecting how well it sticks. If your pouch is a drainable pouch that you're using, could the outlet where we drain that pouch, could that potentially be a bit soiled and need a clean? Could the pouch material or the pouch cover be soiled and be causing the odour? These are a couple of things that you can potentially check yourself and see if that's the source of the odour problem. We need to also think about product issues. So is the filter in your pouch working effectively? So if you've been through every other point and you can't find any reasons why there should be any odour coming out from your pouch, it may be that the filter's not working properly. And this is something you need to talk to your stomal therapist or the ostomy company about. Do we notice some ballooning or pancaking in your pouch? This can affect both the filter and the way that the pouch sticks to your skin. Do we notice some staining on your clothes from the filter? And could the pouch be damaged in any way? So all of these things, have a think and then potentially get some help from either your stomal therapist or the ostomy company. Thinking about troubleshooting, one of the things we really need to look for is residue. So by residue, I'm talking about the sticky base plate residue that's potentially left on your skin after you've taken a pouch off. So once we've taken a pouch off, we need to make sure that that skin is really, really clean and there's nothing left there before we put a new pouch on, because otherwise we're potentially going to get things like sore skin and leakage and all the other problems that I've talked about today. So make sure that there's no residue left on the skin before applying a new pouch, and that you've washed and dried your skin properly before applying that pouch. I've said this one a lot now. How often are we changing our pouch? Are we removing it too frequently, or are we leaving it in place for too long? And it's best to go by your stomal therapist's advice on how often to change your pouch. Is it potentially a change in temperature that might have affected how much residue is sticking to your skin? Sometimes in summer months with humidity and heat, there might be a little bit more residue left on your skin and you might have to do a bit more of a thorough clean. Or especially if you're going on holiday to a hot country, you might notice this as well. Does your skin need some shaving? So if you've got that pulling sensation from any hairs around your stoma at each pouch change, do we potentially need to shave or trim the hairs around there? Because there might be some residue sticking to those as well. These pictures here are some common stoma and skin problems that we see, just so you're aware of what each of them might look like. And you might be able to identify what's going on with your stoma, because it might look like a little bit like one of these photos. So the first is contact dermatitis, and this just means our skin has come into contact with something it doesn't like, and it's gotten a bit red and irritated. So you can see that redness around that top picture of that stoma. You might have a stoma in a crease, which we know now, potentially can affect the way that your base plate sticks and might cause some leakage, and that results in a bit of that redness and that contact dermatitis we just talked about. You might have a parastomal hernia, which is when, because we've created that weakness in the abdominal wall muscle with surgery to create the stoma, your intestines bulge out just a little bit where that stoma is and cause that kind of bulge that you can see. So this can range in size all the way from a golf ball all the way up to a football. It can be surgically repaired, but that's kind of a last resort. Most people with a parastomal hernia actually manage it just fine with potentially things like support garments and different products, and it's best to talk to your stomal therapist about this. Like I mentioned all the way back at the start, you might have an allergy or a product sensitivity to one of the products that you're using. And you can see in this photo with the allergies, that redness looks almost exactly like the shape of a base plate. So it's probably an allergy or a sensitivity to that product. You might have a prolapsed stoma, where your stoma comes out a little bit more than it normally would. In that photo there, you can see there. Again, this is usually quite easily managed and best to talk to your stomal therapist about. You might have a mucocutaneous separation, which is where the stitches that stitch your stoma to the skin in your abdomen, they come apart a little bit and it becomes a kind of wound. This is treated just like a normal wound would be treated and needs to be seen by a stomal therapist. Again, you might have an ulcer, and an ulcer can be caused by a range of things. It might be from leakage or trauma to your stoma, or it might have been, a product that didn't agree with you and it's caused a bit of irritation that's then broken down. Again, it's something that needs to be seen by your stomal therapist, and they'll treat that wound for you. What needs to be seen straight away is a dusky stoma. So this photo of the black stoma there. So if your stoma ever changes colour from that pinky red colour that you're used to a much darker colour, that needs to be seen straight away, because it means that the tissues in that stoma are potentially dying off. So you need to go to the emergency department or see your stomal therapist or your surgeon straight away if that happens. Again, if you have any of the other problems that I've just talked about, have a think about what might be causing them. If it's something you think you can change yourself, have a go. And if that doesn't resolve, best to see your stomal therapist. But for things like ulcers, mucocutaneous separation, allergies, and a dusky stoma, you need some help with that, and it's best to see a health professional. So some solutions, we've already had a little bit of a chat about those, and I think I've said this about 100 times already, but if you're not sure what's going on and your stoma just doesn't look right, book an appointment with your stomal therapist. Really importantly, a lot of problems can often be solved by using a gentle, regular changing technique of your pouch or your product. Again, I've said this quite a few times, but wear your pouch for as long as you're instructed by your stomal therapist. Don't leave it on for too long or change it really, really quickly as well. Be aware of the effect of medication or other medical treatments on your skin and your output. So if you're on a new medication and your output changes and you're really worried about it, think about, okay, we're on that medication, that might be changing things, and just report it to your stomal therapist, GP, or specialist. Check out the size of your stoma and your pouch regularly, making sure that you're using the best option for your stoma. So if you're someone that cuts your pouch out to the right size before you apply it, making sure that we're cutting it so you can't see any skin around that stoma, but also not too tight, so we don't want to strangle that stoma either. So again, checking that size at least once a week. And if you're someone that has a pre-cut pouch sent to you, so the pouch already comes cut out to the right size, again, you still need to check that it's still the right size for your stoma, even if you've had your stoma for a while. Be mindful of food and drinks that may affect your output, such as rich or spicy foods, even just foods that you don't normally eat. All of these things, like before you had a stoma, can upset your stomach. So have a think about those, and if your output changes, maybe just go back to your normal diet for a little bit before trying those foods again to see if it is the culprit. You can potentially consider using accessories such as some seals or flange extenders to support your appliance, and I'll go into those in the next slide. But for those more serious issues like a dusky stoma, which indicates stomal necrosis or death of that stomal tissue, you need immediate medical attention, and it's best to go straight to the hospital, your stomal therapist, or your doctor. So these are just some of the many accessories that are out there to help stick your product onto your skin and to keep your skin nice and happy and prevent any leaks. So you've got things like your flange extenders up the top, which can prevent, like I was talking about, there might be certain areas of your pouch that it doesn't stick as well at that area. So we can help it stick a little bit better at that area and give you a little bit more wear time in your pouch. We've got things like seals and stoma collars to help prevent leakage and protect sore skin. You might need a product change, and that's best discussed with a stomal therapist who knows your stoma and can give you the best advice on what's right for you. You've got things like barrier films, adhesive removers, belts, stoma paste, and pouch deodorant, all of which can make a big difference. But before you add anything into your regime, it's always best to discuss with your stomal therapist what might be appropriate for you. So even if you think you might want to try a couple of these products, best to run it by your stomal therapist, and then you can order a couple of samples just to give it a go and see if it works for you. Something else that we need to think about that's not related to leakage or your sore skin and actually the product on you is how we're storing those products before they even get to being put on around your stoma. How are we storing our supplies? So your supplies should be kept somewhere easily accessible. However, that shouldn't be in a bathroom with a shower or bath, as steam and moisture can really affect the adhesion of the base plates. So if there's somewhere with quite a lot of steam or moisture, or even if you've traveled somewhere or if you live somewhere that's quite humid, or if it's a really hot, humid summer, you need to be sure that your bags are kept somewhere cool and in a dry place out of direct sunlight, because both moisture, heat, and sunlight can all affect the way that the base plates stick to your skin. So we just want to make sure they're kept in the best condition and that they work really well for you when you need them. If you have any more questions after watching this, please contact your stomal therapist, and there is a list of stomal therapists in Australia and New Zealand if you're not sure who your closest one is. So that's www.stomaltherapy.com for those in Australia and www.ostomy.org.nz for people in New Zealand. You can also jump onto any of the ostomy company websites where we have lots of information and booklets that you can download or request to be sent to you. And we do also all have company customer care, which is both online and over the phone. So thank you for listening to me today, and I hope it was helpful.